If the whole cuff is torn off, it's actually not terribly painful because there's nothing connected, you just can't move your arm. In that case, it's quite dramatic, and we usually need to fix that pretty quick to get your function back. I enjoy patients who have rotator cuff tears. They are pretty clear about what's going on and how much they don't like it. They're often unsure exactly what the problem is. When I see a patient with concern for rotator cuff tear, they often hold their shoulder in a pretty guarded position, which is my first clue that maybe something's wrong. Stiffness often accompanies rotator cuff tears and has to be sorted out from weakness due to pain or weakness due to functional issues. We'll perform a series of examinations after discussing the history we talked about before. And during the examinations, I'm testing common other conditions that occur with rotator cuff tears. I'm testing the degree of pain, the degree of dysfunction, and possible routes to get to the answer that we need. We'll often get an x-ray, and the x-ray can rule out bigger conditions like arthritis or other ominous findings. Often with a rotator cuff tear, we'll see normal x-rays, which is actually quite encouraging, or maybe a little bit of wear and tear. After the x-ray, if rotator cuff tear is a high probability, the next step is often an MRI, or if we're going to go slower, we may work up with therapy for a little while. Another common option is to consider different types of anti-inflammatory injections to separate the structural issues from the pain and inflammation issues. Going back to what is a rotator cuff tear? If you think of the ball of the shoulder with the 4 muscles attaching, rotator cuff tear is simple detaching of some or all of those muscles. Depending where one is at on the process will affect our treatment. If the whole cuff is torn off, it's actually not terribly painful because there's nothing connected, you just can't move your arm. In that case, it's quite dramatic, and we usually need to fix that pretty quick to get your function back. Many tears, though, are more smaller tears where the top muscle starts to tear, either in a partial or complete way. And some of the smaller tears, we may try more conservative measures such as anti-inflammatories, physical therapy, steroid injections, platelet-rich plasma, other stem cell type injections to try to avoid surgery. However, many times, tears will worsen during that process, and we'll have to proceed to fixing a rotator cuff tear, which usually involves reattaching what was lost. One of the most common questions that I get about rotator cuff tear surgery is, what is the rehab? And to be honest, it's a tougher surgery than some. It takes a long time to heal a rotator cuff tear, and certainly the degree of tear affects the degree of recovery, and the patient's approach and their health status certainly affects the recovery also. Typically, surgery is outpatient surgery. You go home the same day and you hang out in a sling for about a week to get over the pain. And the pain is pretty intense, but there's some newer nerve blocks and other pain medication and treatment modalities that we've learned about and worked with for years to help you through that first week. And everybody gets through it and it goes okay, but it is memorable. By 2 weeks, hopefully you're over the worst of it and starting to get optimistic about getting this arm moving. And we'll usually see you back in clinic at 2 weeks and make sure the wounds are healing well and you're over the worst of the surgical issues. And then we may consider starting physical therapy at that point, mostly to loosen the shoulder. That muscle that's been reattached isn't really ready to be stressed. It needs mostly to rest, but we can certainly move that shoulder around and get it mobile so we don't run into conditions like frozen shoulder or other bursitis and stiffness issues that complicate recovery. Some of that, unfortunately, is genetic or hereditary, where some people just get stiff, and we work through that. By 6 weeks, the muscle tear is starting to heal somewhat, where we can give it a little bit of stress, where you can start lifting light things to the point where at 3 months, you can lift everything. Just because I allow you to lift at 3 months doesn't mean you are, because you've had 3 months where you haven't lifted much. So there's a lot of work over the next 3 months to get strong. The best patients are quite functional by 6 months after surgery. Many are quite functional by 3 months, It's worth saying it takes a year to get over a rotator cuff tear surgery. Now, much of the recovery occurs in the first several months, and especially if stiffness isn't an issue, many patients feel quite good by 3 months. If stiffness is an issue, often 6 to 9 months is common before you feel really over the stiffness of the surgery. But by 3 months, the muscle's healed well enough that almost always we can get you lifting in an unrestricted way and have you be in charge as opposed to me limiting you by 3 months.